is to prevent dementia on a large scale. So I think a big shout out to Silver Talkies, because this is a medically proven thing that the more you interact socially,
I had the pleasure of getting the first copy.
So this book is titled Rethink Aging, Lessons in Aging from the Older and Bolder Generation. I request all the guests to hold up their copies.
I think, idea that they have come up with. They bring together members or senior citizens and create a social community. As you understand, as we grow older, because we stop working, we start losing touch with our friends. And of course, unfortunately, some friends go before us, so our friend circle starts becoming less and less, and we start becoming isolated. This has proven to be the big factor in people developing brain disease, that's degenerative brain disease like Alzheimer's, lack of social contact. Silver Talkies has changed that space now. Now they can come together as a community. It's a very loving, vibrant community, and then they can all interact and do well. And today I really appreciate what they're doing. We talk about preventive screening. They're also talking about preventive health. So now here today people can get an idea of how to take care of their health, also their finances, and also their social life. So I really appreciate this event, and I'm very happy to be a part of this event. So thank you to Silver Talkies.
Frontliner during COVID, just like Dr. Amarnath. But yes, over the last 1.5 years, it's been a rewarding entry into preventive health for me. And of course, it's the same amount of time that I know Nidhi's son, as we call it, we're all Japanese, yes. So Nidhi, we know her since the last 1.5 years, Chitra also as well. And I've always been amazed when I meet the Silver Talkies crowd. It's been amazing. I've probably done about 3 or 4 sessions, talks with them. Such a vibrant crowd. I don't get that crowd anywhere else. I mean, all due respect to all the other crowds. But I know when I go for a Silver Talkies meeting and I'm delivering a health lecture, I will have questions. I know I will talk only for about 25 odd minutes, but then the question answer session will go for 40, 45 minutes, and then he's going to say, okay, we have to end now. Time's up, we have to go. And that's how all the Silver Talkies events happen, and I'm really happy to be here and seeing such a full crowd. Nidhi-san was like, we're coming back after 2 years, post-COVID, I don't know how many people will come. Nidhi-san, full house. Congratulations. All right. Okay. Dr. Amarnath talked about how we can stay healthy or prevent having any mishaps that take us to the hospital, and meet him, although he's a very pleasant personality, as you noticed from the whole conversation. What I'm going to show you is how to know if you're healthy. And that is the area that NURA deals with. So let's go on without any further ado. So what makes us happy? That's what I want to start with. Right? So these are some of the things that we love to do.
So thanks for your question, sir. I'll answer it from both angles. From a doctor's perspective, EHRs are something which are really required, especially when I need to, with an elderly person who has about 8 to 9 medicines, about 4 or 5 chronic medical conditions, multiple treatments. So I think that's something which we do require. But one of the fallacies of technology in healthcare is that more often than not, what we see is it's a technology company which prepares an EHR and comes and says, look, I have a solution for you. Can you figure out how to use it in your clinical setting? And when you have 30, 40 patients waiting for you, and the last thing you'd want is look at the computer and keep entering data into that one. So that's our pain point as clinicians. But I think what we will have going forward is, if you've been reading the press, India is coming up with something called as the India Health Stack. And like how you have UPI, which changed the payment landscape in India, you will have something called as the UHI, the Unique Health Identifier. So that will be a repository of all your health records across India going forward.